Welcome to the Privacy and Security Training for the Iowa Health Information Network, commonly referred to as the IHIN. This training is to provide you a quick look at the privacy and security policies at an organizational level. This presentation will consist of 3 separate segments, beginning with a summary of the IHIN, followed by some general definitions, and conclude with an overview of the privacy and security policies. The IHIN is a health information exchange system that was established by the state of Iowa to safely exchange protected health information among healthcare organizations. The IHIN allows healthcare providers to appropriately access and securely share patients' vital medical information electronically. The IHIN helps facilitate coordinated patient care, reduce duplicate treatments, and avoid costly mistakes. There are 3 services offered by the IHIN: patient lookup or query, direct secure messaging, and state reporting. Access to patient lookup is obtained once an organization's EHR is connected to the IHIN. Organizations can access patient lookup using their EHR and request clinical health information from the IHIN for a specific patient. The IHIN queries all organizations connected to the IHIN and returns any clinical health information found for the specific patient. For example, when an individual presents to a primary care physician as a new patient, the nurse can access the IHIN, request and receive all the clinical health information obtained during patient encounters at other facilities. Upon review, the physician can find health information such as problem lists, lab reports, allergies, and medication history required to effectively care for this new patient. Direct secure messaging is a transport tool that allows providers and their staff to send protected health information securely across the internet from one direct address to another outside of their own network. It is similar to email, but utilizes certificates of authority and auto encryption to provide a higher level of security. Direct secure messaging can be used to send referral information to a specialist, send transition of care documents to a long-term health facility, or send hospital discharge instructions to a primary care physician. Direct secure messaging can be used to send patient health information between providers and their staff in place of current methods used, such as telephone, mail, or fax. In the future, direct secure messaging will be available to facilitate communication between the patient and provider. The IHIN allows healthcare organizations to report diseases and immunizations to the state of Iowa. Reportable diseases can be sent to the Iowa Disease Surveillance System, commonly referred to as IHIN, using direct secure messaging or VPN. Immunization data can be sent to and received from the Iowa Registry Information System, commonly referred to as IRIS, using web services. The future state of the IHIN will include connections for reporting to additional registries, such as the Cancer Registry. There are a few terms and definitions that apply to the privacy and security policies that we will review specifically for today's training. A complete listing of the definitions can be found in the Privacy and Security Policy document located on the eHealth website. A participant is an authorized organization that has voluntarily agreed to enter into a participation agreement to access or use the IHIN. An authorized user are members of a participant's workforce who are individually authorized by a participant to have access to the IHIN. Workforce refers to the employees, volunteers, trainees, and other persons whose conduct in the performance of work for a covered entity is under the control of such entity, whether or not they are paid by the covered entity. The department is the Iowa Department of Public Health, referred to as IDPH. The individual is a patient or client of a participant. Other participant refers to other entities that have access to the IHIN and have signed a participation agreement containing an obligation to comply with the IHIN policies. This training is only a summary of the IHIN privacy and security policies, and some portions may not reflect the exact language, terminology, or phrasing used in the official privacy and security policies document. All organizations are required to review the details of the IHIN privacy and security policies, which are located in the resources section of the Iowa eHealth website. To promote better understanding during this training, we will refer to participant as organization and individual as patient. We will also indicate which policies are informational and which policies may require you to take some action within your organization. Prior to review of the privacy and security policies, it is important to note that at this time, the patient lookup function of the IHIN can be used for treatment purposes only. This is described in Amendment 1 of the Privacy Policies and Security Policies and is located on page 3 of each of these documents. Amendment 1 highlights those policies that are impacted during the treatment-only period. Amendment 1 is scheduled to expire on June 30th, 2015. Should legislative change or advances in technology allow for this amendment to expire prior to June 30th, 2015, you will be notified. There are 12 Iowa Health Information Network privacy policies that apply to the access, use, and disclosure of protected health information by organizations through the IHIN. The first privacy policy, Compliance with Law and Policy, is informational. It requires that organizations comply with all applicable laws and the privacy policies we are about to review while accessing and using the IHIN. If an IHIN policy conflicts with an organization's policy, the IHIN policy prevails unless the organization's policy is more restrictive, which is allowed but only for that organization. Privacy Policy 2, Notice of Privacy Practices, specifies that organizations shall develop, maintain, and distribute Notice of Privacy Practices describing uses and disclosures of PHI contemplated through the participant's participation in the IHIN. Your organization is responsible for developing the standards around distribution of Notice of Privacy Practices and obtaining patient signatures. Your organization is also required to review and update their Notice of Privacy Practices policies and procedures to include the IHIN. Privacy Policy 3, Individual Controls of Information Available through the IHIN, specifies that patients can choose not to have their health information included in the IHIN. Iowa is considered an opt-out state, which means that all of your patient's health information is automatically shared with the IHIN until he or she chooses to opt out. Once a patient opts out of the IHIN, none of their health information will appear or is shared with the IHIN. Individual providers or records, such as medication lists, cannot be selected and excluded from the IHIN. A patient may opt out of the IHIN by completing the electronic form available on the Iowa eHealth website, or they may download the form and mail it to the address shown on this slide. Once the request is received, IDPH will make the change within 3 business days. Forms and instructions for patients to opt back into the IHIN are also found on the eHealth website. Your organization will develop and maintain written policies and procedures used to educate and inform patients about the IHIN and the opt-out option. Privacy Policy 4, Access to and use of disclosure information, specifies that organizations only access, use, and disclose protected health information through the IHIN only in a manner consistent with federal and state laws and regulations. We recommend that you refer to your organization's policies along with the federal and state laws regarding PHI. Privacy Policy 5, Information Subject to Special Protections, specifies that organizations should not make protected health information requiring special protection available to the IHIN unless the patient has consented or the disclosure is permitted by law. IHIN policies utilize HIPAA as a foundation for their privacy policies along with state and local laws and regulations. Again, we recommend that you refer to your organization's policies along with the federal and state laws regarding PHI. Privacy Policy 6, Minimum Necessary. This policy is not applicable at this time because it addresses the use of health information for purposes other than treatment. As presented earlier, Amendment 1 of the Privacy and Security Policies regarding treatment, payment, and operations specifies that information obtained through the IHIN can only be used for treatment purposes until July 1st of 2015. We recommend that you review this amendment with your organization's staff. Privacy Policy 7, Workforce, Agents, and Contractors, specifies that organizations and IDPH are responsible for policies designed to comply with its responsibilities as a covered entity or business associate under HIPAA and as an organization in the IHIN. Authorized users of the IHIN must report noncompliance with the privacy and security policies directly to the IHIN Privacy Officer. Your organization is responsible for training of all personnel on the privacy policies governing the access and use of the IHIN. Privacy Policy 8, Amendment of Health Information, is informational and specifies that each organization is required to comply with applicable federal and state laws and regulations regarding patient rights to request an amendment of their health information previously submitted to the IHIN. Patients wishing to amend their health information obtained through the IHIN should contact the healthcare provider that originally provided the information to be amended. Privacy Policy 9, Requests for Restrictions, specifies that organizations who agree to a patient request to restrict information should not make that information available through the IHIN. Organizations should advise patients about the implications of restricting data from the IHIN. Privacy Policy 10, Mitigation, specifies that organizations and IDPH are required to mitigate the harmful effects of privacy breaches occurring through the IHIN. IDPH and organizations have a duty to mitigate, cooperate, notify, and investigate privacy breaches. We recommend that you refer to your organization's privacy breach policies and review the IHIN privacy policy on reporting privacy breach incidents. Privacy Policy 11, Breach Investigation and Incident Response, specifies that IDPH, IHIN organizations, their business associates, and contractors are required to investigate, respond to, and report privacy breaches related to the IHIN in compliance with applicable federal and state law. The IHIN Incident Response System includes notifying other organizations, providing audit trails, developing remediation plans, and cooperating in investigations. We recommend that you review your organization's policy and procedure for privacy breaches in incident response along with the federal and state laws. The 12th and last privacy policy, Authorized Personnel and Authorized User Controls, specifies that IDPH and organizations will be responsible for designating, training, supervising, and ending access to the IHIN by authorized personnel. Your organization is responsible to train all personnel on the use of the IHIN and develop written policy on the setup, training, and removal of users for the IHIN. There are 11 security policies that define and clarify policies, principles, standards, guidelines, and responsibilities related to the security of the Iowa Health Information Network. The first security policy, compliance with law and policy, requires that organizations comply with all applicable laws and the security policies we are about to review in accessing and using the IHIN. Your organization will be a HIPAA-covered entity or business associate and is responsible for the training of all personnel on the security policies regarding the IHIN. Security Policy 2, Information Stewardship, is informational and specifies that the purpose of these security policies is to provide a framework for protecting information. IDPH will provide a secure environment for the exchange and protection of information, and organizations will ensure that their authorized users meet all privacy and security obligations in the IHIN participation agreement. IDPH will provide a secure environment for the exchange of information through the IHIN by providing backup and recovery systems and protecting IHIN from unauthorized access, destruction, or usage. Security Policy 3, Privacy and Security Governance, is informational and specifies that IDPH will be responsible for managing the daily privacy and security activities and issues of the IHIN. The Privacy and Security Workgroup provides overall direction and guidance regarding IHIN privacy and security. Security Policy 4, IHIN Privacy and Security Officer and Participant Security Point of Contact, states that IDPH will designate an IHIN Privacy and Security Officer. Organizations will designate a security person who will be the main point of contact regarding the IHIN. Both will be responsible for the operational aspects of these security policies, and both shall have authority commensurate with his or her responsibilities. Your organization is required to assign an individual as the security point of contact regarding the IHIN and file this information with the IDPH Privacy and Security Officer. Security Policy 5, System and Technical Security Requirements, contains 5 sub-policies. Sub-policies 5A and C are informational. Sub-policies 5B, D, and E require your organization to review your current procedures to ensure they meet the requirements for security. 5A specifies that IDPH will protect information in the IHIN equipment and other assets. 5B specifies that IDPH and organizations will use workstations that will safeguard the confidentiality and integrity of PHI. 5C specifies that all transactions through the IHIN must be encrypted, and the encryption technology must be configured in accordance with industry best practices. 5D specifies that each authorized user will have a unique logon ID and password for accessing the IHIN. An access control system will identify each authorized user and prevent unauthorized users from entering or using the IHIN. 5E specifies that organizations will require strong passwords which are changed frequently for all authorized users. Security Policy 6, Information Access Management, specifies that IDPH will give organizations access to the IHIN as set forth in the participation agreement and the IHIN privacy and security policies and procedures. Organizations will give IHIN access only to those workforce members requiring information for the purpose of patient treatment, and will have policies in place to prevent unauthorized persons from accessing the IHIN. Computer systems which access the IHIN must meet HIPAA standards regarding the detection and recording of unauthorized attempts to penetrate the system. Please refer to Amendment 1 of the Privacy and Security Policies regarding treatment, payment, and operations. Security Policy 7, Security Awareness and Training, specifies that all authorized users will be required to complete security awareness training, which will include the IHIN privacy and security policies, and sign an authorized user agreement prior to accessing the IHIN. Components of IHIN security training include how to report security concerns or incidents, including acceptable and unacceptable uses of the IHIN. Your organization is responsible for training of all personnel on the security policies regarding the IHIN. Security Policy 8, Information Systems Audit Controls, specifies that IDPH and organizations will review IHIN activity on a routine basis to monitor IHIN connection and query activity. The auditing requirements established through HIPAA and the HITECH Act that require providers to log and maintain an audit trail of every access, use, and change to a patient record extends to the auditing requirements of the IHIN. Your organization will develop an audit trail procedure to support the audit requirements of the IHIN. Security Policy 9, Security Incidents, Notification, Investigation, and Mitigation, specifies that IDPH and organizations will investigate, respond to, and report known or suspected security incidents related to the IHIN in compliance with applicable federal and state law in accordance with the participation agreement, IHIN privacy policies, and these security policies. Organizations with a confirmed or likely breach should notify IDPH with as much information as soon as possible within 7 days. Your organization will train all personnel on the policy and procedure for reporting potential security incidents. Security Policy 10, Risk Assessment and Management, specifies that the department and the participants shall conduct an initial security risk assessment and subsequent risk assessments as provided in this policy. Your organization will need to develop a risk assessment procedure, conduct a security risk assessment prior to IHIN use, and perform routine risk assessments thereafter. The final security policy, Disaster Recovery Plan, is informational and specifies that IDPH will have a disaster recovery plan and periodically assess potential risks and vulnerabilities to the IHIN. This concludes the privacy and security training for the Iowa Health Information Network. As a reminder, all organizations are required to review the details of the IHIN privacy and security policies and their amendments located in the resources section of the Iowa eHealth website. Thank you for joining.